Welcome to Wildlife Rehabilitation from Rescue to Release, a podcast dedicated to licensed wildlife rehabilitators and the veterinarians who support them. I'm your host, Gail Buhl. Techniques we discuss here are meant for licensed wildlife professionals. If you aren't licensed and trained for wildlife rehabilitation, do not attempt to capture, hold, or rehabilitate any wild animal. If you find an injured wild animal, a wildlife professional can recommend next steps. We will tackle topics about rescue, care, management, reconditioning, and releasing wildlife found in North America. This is a deep dive into each subject. We hope to give rehabilitators information they can use because they're already going to great lengths to rescue and nurse animals back to health. There are 3 possible outcomes in wildlife rehabilitation: release, euthanasia, and placement. An injured or orphaned wild animal's journey to restored health and independence in their natural habitat is delicate and complex. We draw techniques and expertise from many disciplines. Many animals brought into rehabilitation cannot be saved. The last gift we can give them is humane euthanasia. We'll talk more about when this is necessary. Sometimes animals are deemed non-releasable and evaluated to be suitable for a life in captivity. When that happens, we shift to a long-term approach to managing their care, training, and housing. Some such animals serve as ambassador animals, a term for animals that rehabilitators use to educate the public. Each episode, we'll speak with experts who represent specialty topics across the profession of wildlife rehabilitation, ambassador animal care and management, showcasing best practices. Well, welcome everybody. Oh my goodness, I can't even tell you how excited I am today. I am at the NWRA 2023 conference in Wilmington, Delaware, and I am speaking with Jennifer Martinez and Dr. Rebecca Duerr from International Bird Rescue, and we are going to be talking about brown pelicans, and I cannot wait to get into this conversation. I'm very excited. I love pelicans, birds in general. But I'm from Minnesota. We take care of white pelicans. I don't know a lot about brown pelicans, but my guests certainly do. So what I would like to do is just very briefly have you introduce yourself and your position at International Bird Rescue, and maybe just a little bit of your origin story. How did you land where you are now, and whether it's interest in birds or specifically brown pelicans. Jennifer, we'll start with you.
Hi, my name is Jennifer Martinez. I'm from Los Angeles. And my origin story is that after graduating college, I actually got an internship in China. Went there, was banding some birds, and though I loved it and thought my field was going to be wildlife biology, being a field tech, I had an incident with a bird and accidentally his leg broke. So we had to take it to a rehab that was located in China. And there I noticed that the bird could have been put into better conditions. Sadly, he didn't make it. So my internship ended, and like I said, I'm from Los Angeles, so I came back home, didn't know what to do, and then basically was like, what could I do in the meantime? Looked up online, found out that there was an internship for International Bird Rescue, and I've been there ever since.
Wow. And when did you land at International Bird Rescue?
I started in September of 2018.
2018.
So 2018, then I got hired almost immediately. So I like to say I started in 2018, and I'm still working there.
Still working there. Excellent. Oh, thank you for that. Oh, man, talk about a route, right? Going across the world and then coming on back. I love it. And I find that a lot of folks that get into wildlife rehabilitation partly is because they have found an injured animal and they're like, wait a second, I can do this? Or there's nobody to do this, so I would like to do this. Or that's how they find the interest. So, oh my gosh, Jennifer, thank you. Welcome. And we have Dr. Rebecca Duerr here. Can you give our audience just a little bit of your origin story and what you're doing at International Bird Rescue now?
Sure. So these days my title is the Director of Research and Veterinary Science at International Bird Rescue. I'm the primary veterinarian at both of our centers in San Francisco and Los Angeles, so I do a lot of traveling. For them, my role largely revolves around surgical procedures, wound management, anything the staff can't handle or wants my input on, and then dealing with research projects.
Okay.
And how did I get there?
How did you get there?
It was a convoluted road.
It's always crooked, isn't it? Crooked road.
I started volunteering with marine mammals at the Marine Mammal Center in Sausalito when I was 21. And I eventually got sucked into working there as a staff person and was involved in disease research and disease ecology as someone who never graduated from college. I was a college dropout. And then I eventually got a bird job by working at the Marine Mammal Center.
Okay, pause here. Marine mammals, birds. Was it mostly like seabirds then? Is that the connection?
No, not at all. We were working one Christmas Eve, so staffing holidays is always a problem. So my husband and I were volunteering at the Marine Mammal Center on a Christmas Eve, and we were working with someone we didn't normally work with, and talking about what we were doing with our lives with the people working that night. And one of the women there was like, "I've got the job for you," and she hooked me up with working at a little wildlife center in Palo Alto.
Wow.
Yeah, so I ended up working in a small urban wildlife center with songbirds, doves, pigeons, kind of your typical urban wildlife, squirrels, etc.
Sure.
And I was there for several years, and then finally went back to working at the Marine Mammal Center. Finally decided to go to vet school. And eventually ended up deciding that I really wanted to work with birds professionally. So.
Excellent. Yeah, I mean, there's over 10,000 different kinds of species of birds in the world, so there's lots of variety to choose from.
Exactly. So I eventually overeducated myself and moved into water birds in college. During vet school, I started doing a project on oiled wildlife as a vet student, and then eventually worked on my PhD with the animals at International Bird Rescue, and then they hired me. So
okay, yeah, I was reading that your PhD project was mostly with common mewers,
common murres and western grebes.
Yeah, excellent.
And I was going to work on surf scoters as well, except that we didn't really get any during my study period.
Yeah, makes that sample size a little hard.
Yeah, it's a guarantee if you want to do research on an animal, that's the year you don't get any.
That's the year you don't get any. Yeah. Well, thank you. Thank you very much for that. And there is some letters behind your name that I am not exactly sure what they are, and it's MPVM. Could you explain that?
Yeah, that's a UC Davis program. It's a Masters of Preventive Veterinary Medicine, which sounds like vaccines, right? But it's actually kind of like a Masters of Public Health, except it's designed for veterinarians.
Okay.
So there are lots of international students that do it, but I did it as a joint program with the DVM.
Okay, excellent. Thank you. I was like, I know what all those other letters are, but I wasn't sure about that. So for those people that are listening that are not familiar with the International Bird Rescue, could one of you kind of explain just a little bit of the background of IBR?
So International Bird Rescue was created after a big oil spill in San Francisco Bay in 1971. So we're 50 years and going on. And for many years, International Bird Rescue has been responding to international oil spills, like the Treasure oil spill in South Africa, and has kind of specialized in the responses to large stranding events. So as oil spills have declined in numbers over the years, we've started doing a lot of responses that are not oil spill related.
Okay.
So we essentially specialize in response to mass stranding events, really, or mass health events.
Mass health events. So with birds, I mean, I know what a stranding event looks like, or for like marine mammals in general, but what does that in general look like for birds?
So seabirds are particularly prone to having what they call wrecks. Okay. So it's a wreck of seabirds. So that means that a whole lot of animals that normally live out in the open ocean or near shore are stranding all at once, like something's happened. For example, that could be a harmful algal bloom, or an oil spill, or a problem with there's no food for a certain species to eat, bad weather.
Okay.
All sorts of different causes.
Okay, thank you. I'm like, I know what it is for
but
whales.
we also have, so we have 2 wildlife centers, one for Los Angeles, one for San Francisco, that are open for regular wildlife rehabilitation, every day of the year.
Okay.
And then we also may dispatch teams to go work on an oil spill.
Okay. How many staff then at IBR?
We have...
Or is it too many to count? And there's probably volunteers?
I think we tend to sit in the 30 to 50 people range.
Okay.
Which is, 2 pretty large centers, plus some administrative staff, plus some oil spill response people.
Do you guys utilize volunteers?
Absolutely.
Say most rehabilitation centers cannot do it without volunteers. Yeah, they are kind of the backbone of how all this stuff gets done. Thank you for that. So, and I did take a look at the website, and in 2022, you admitted just under 4,000 birds. That's a lot of animals to take care of. But today, we're going, well, maybe I should back up a second. About how many species of birds is that?
Oh, we see, we see large numbers of certain species, but we specialize in aquatic birds.
There we go.
So in many ways, we act kind of like a referral clinic in the veterinary world. So, if your dog needs to go to a neurologist, you go send them off to a neuro center. So we get animals from other wildlife centers very commonly as one of our major sources of animals.
Okay.
Since we have pools and huge aviaries for pelicans and stuff.
Yeah, and we're going to get into the care and management, and with pelicans,
yes,
equal water bird, equal lots of interesting management and intense management. But so we're going to get into talking about brown pelicans. And in 2022, you got 335 brown pelicans. That's one of the reasons we wanted to talk about brown pelicans, because you have a lot of experience, I'm sure, over the years. But in 2022, that is a lot of bird.
I think we actually had more on the order of 400 total.
Oh, wow.
Yeah,
Okay.
if you include both centers.
Both centers. Okay.
Yes.
Okay. So that's definitely helpful to know. So what I would like to do is first talk a little bit, and maybe Jennifer, you can help with this, a little bit of the natural history of brown pelicans. Oh, we're going to go back to Dr. Duerr for natural history, and I can maybe fill in a little bit. We certainly in Minnesota see a lot of white pelicans, which of course are a very large water bird. They eat fish, but for Minnesota they migrate. So as far as brown pelicans are concerned, kind of that's the down and dirty basics of white pelicans. But how about brown pelicans?
Brown pelicans are super cool.
I believe it.
Okay.
I believe it. I've seen them on vacation and watched them dive.
White pelicans tend to live in freshwater environments, so brown pelicans are very much marine-oriented birds. There are 5 subspecies, so our California brown pelican is a bit different than some of the East Coast or Gulf Coast subspecies. So ours are most colorful when they're breeding. They actually get a beautiful bright red pouch. And their eyes are a little bit different looking. So their breeding plumage is a bit different looking than the eastern subspecies. Okay. So our subspecies, migrates north and south along the west coast. And they typically range from down in Mexico, on the west coast of Mexico, up to British Columbia. But they need to leave cold areas before it gets too wintry.
Right.
They are prone to frostbite. So they need to get out of Dodge before the beaches up in Oregon and Washington get cold.
Okay. What is that season look like? I mean, when they start migrating, is there a particular, it's October?
It's very much weather dependent, it seems. So sometimes they'll stay too far north for too long.
Okay.
But their breeding range is down the Channel Islands off California, south into Mexico. So a big chunk of them historically bred in Mexico, but the Channel Island colonies are up and coming.
Oh, that's interesting. So up and coming. I don't know if we're going to have a chance to really talk about that, but maybe I will find out some information to link in the show notes.
So one major issue with brown pelicans was that they had near extinction event back in the 50s and 60s from DDT problems.
Okay.
And then when DDT was banned in the 70s, their population started to recover.
Okay. And did they recover fairly naturally, or were there a lot of interventions like reintroduction programs and things like that with pelicans?
On the West Coast, it was a fairly natural recovery.
Mm-hmm. Okay.
However, there recently was discovered that the problem isn't gone.
Oh,
Yes,
interesting.
plot thickens.
Yeah, the plot thickens.
Yeah, so in 2019, it was discovered by some oceanography folks at UC Santa Barbara that there are some 30,000 plus barrels of chemical waste between Los Angeles and the Channel Islands where the pelicans breed, down on the ocean floor. The company that did that had a big settlement already. The company's defunct. It was a Montrose chemical company. And those barrels are found to be degrading, so it's an up-and-coming returning problem, potentially.
Returning problem. And so it looks like in the future, hopefully near future, something needs to be done.
Yeah.
Some type of mitigation and hopefully removal, whatever. So,
Yeah.
oh,
Stay tuned.
stay tuned. Stay tuned for that. What about, back to natural history, how long, so breeding pelicans, do pelicans, male and female, kind of stay together for life, kind of rejoin up? Do they stay together all the time? Do they not? Do they just find a new mate every year? Only have one chick, two chicks? What does that look like?
They can lay up to 3 eggs, depending on fish supplies. Baby food supplies can get short. So in a really good year, they might fledge 2 chicks, but more commonly it would be only 1.
Okay.
They eat some of the main fish that are overfished by humans, so there can be some fish supply problems
Sure.
in certain years. The males and females, I don't think they stay mates year after year. I'm pretty sure it's serial monogamy.
Ooh, okay. That works for, that is definitely a strategy.
One odd thing about them is that their chicks are quite altricial. They hatch really small, like 70 grams for an animal that can be 5 kilograms when it's an adult male.
Right.
So that's pretty tiny. So they're quite altricial.
So they're altricial, so they're very,
Yeah.
very small.
Yes. Oh, and they take a long time to grow up, so the parents require a huge amount of food to feed these chicks. And so pelicans are plunge divers, unlike white pelicans who more dip net.
Right.
Pelicans plunge dive from up to 60 feet in the air and eat food that way, but they're really limited on how deep the food that the fish they can catch.
Oh, so that helps determine the species of fish that they're catching.
Yes.
Right.
Yes, and they can end up running into some problems if the fish are too deep to catch.
Okay.
So they are prone to starvation events.
Okay. So I'm a pelican chick. I am being fed regurgitated food.
Yep.
Okay. And how long does it take from hatching to fledging?
Oh,
About.
typically about 3 months.
Okay.
It's a pretty long childhood for an altricial chick.
Okay. Okay. Once I am flying, then am I still dependent on my parents for a while, or?
No, but in many ways, pelicans crash, if you know what that means, where the youngsters end up being in kind of a small flock, and sometimes off the coast, it almost looks like they're having a class with an adult. Like you'll see a nice mature breeding age bird with a larger number of juveniles following them around, like figuring out how to dive, how to catch fish, where to go.
Okay.
Yeah, they're very social birds.
Excellent. So social birds. So when they're nesting, are they nesting in larger groups, and are they nesting on the ground? They
Nest on the ground. They have some issues with cactus down in some areas. The chicks can get problems with thorns. And they do nest on the ground. Some areas of the world they do nest in mangroves. So on the Gulf Coast, the subspecies over there nest in mangroves, and sometimes down in Mexico as well. We don't have mangroves in California, so it's on the ground.
Okay. Okay.
But they're colonial.
Okay, but colonial. And then, so the youngster is fledged, it's in a creche, it's learning in class how to hunt and that kind of thing. How long does it take for them to become a breeding animal?
Typically, they go into breeding plumage after 3 years of age.
Okay.
But every now and then we'll have some that are very strangely colored with juvenile plumage going into breeding colors. And apparently those animals are ones that are in exceptionally good condition and going to get started early. So precocial teens.
Okay.
So we do see some odd coloration sometimes.
Okay.
Because of that. But it's generally the over 3 crowd are the ones that are breeding.
Okay. Anything that you're like, everybody needs to know this about their natural history? That, I mean, you've mentioned some things that are wonderful. I have been able to see brown pelicans dive, and it is just fantastic. When they get close to the water, those wings go folded way back so they don't interfere with the dive, and bill first right into the water like a knife. Yeah. It's just amazing.
I think one of the most scenic things in California is watching them fly along the cliffs in groups. So they'll fly in a line, just either 3 feet off the water, just like cruising along the surface of the water in a string of birds. Or higher along the cliffs. It's just really, really beautiful.
Yeah, using those deflective air currents to really help them move. Oh.
So seasonally they go one direction and then they kind of go the other direction. Yeah. It's not exactly a linear count them as they go by, but
Sure. Oh my gosh, excellent. Okay, so we talked a little bit about the natural history of brown pelicans. I know we can spend the entire time talking about it, which we may at one point or another. But what I really would like to kind of get into is why they come into rehabilitation and what, maybe even when they come in, if there's a certain kind of quote-unquote season, and maybe age classes of, like, I don't know if you see very young birds or juvenile birds that are already maybe on their own or flying and that kind of thing. So Jennifer, could you help us understand how and when and what kinds of injuries and the reasons they come?
Yes, and basically what we see a lot about these birds is that we see some younger birds come into our center. They tend to come in year-round, and we do live in an urban environment, so a lot of the times the injuries that we find with these birds are primarily fishing line and, of course, starvation, and sometimes we even get them contaminated with oil, depending on the season along in winter. But I would say that the main issue might be just fishing line, that they come in with these injuries, especially around constriction wounds, fish hooks, sometimes even pouch lacerations. So we tend to see a lot of those.
Okay. So a lot of anthropogenic type
a lot of anthropogenic causes.
Right. And starvation, sometimes natural events, sometimes not.
Well, it depends. Do you count a lack of fish because humans caught all the sardines and anchovies? Is that natural or not natural?
Oh, right. I mean, certainly that's one of the reasons we should have in place fishing regulations so that doesn't happen. But I'm sure, depending on the year, too, there might be a little bit more, a little bit less.
Absolutely.
Yes.
Those kinds of things.
And we're dealing with 2 different countries in their range. So, the fishing rate, what happens with those feeder fish off of forage fish, I guess they call them, off of Mexico is also a big issue. And I think that's one of the reasons their breeding range is tending to be shifting towards the Channel Islands. It's because the fish stocks have been quite depleted off of Baja California.
And I mean, in one way, that's very nice to hear that they're adaptable enough that they are shifting, whether it's slowly or fairly quickly, to a place where they are more successful at raising.
They've also broadened the range of months that they breed in. So their breeding system has their breeding season has encompassed 10 months of the year now. So it's so they can start nesting in November, or they can start nesting in January. It's like,
well, okay then.
I see them all times of the year. There's not a season.
Right. So we have kind of, especially at our Los Angeles Center, we have kind of a background level of fishing line injuries, fishing gear injuries, I should say, all year round.
Okay.
Mm-hmm.
Okay. Special events do other things.
Do other things. Okay, so IBR gets a phone call. I think I've got an injured or something's wrong with this brown pelican. So Jennifer, who are finding these birds?
So we actually are very fortunate that we're able to work and communicate with a lot of the local organizations in our community. So we really do depend on them. So as Dr. Becky was saying earlier, we are like a specialized center. So we work very closely with Santa Barbara Wildlife Care Network, California Wildlife Center, in Southern California. In Northern California, I don't really know which ones, but
There's like 35 different
exactly.
animal
There's
control.
so many in the Bay Area, but those are the main two. And of course, we do get members from the public, but a lot of animal control. We really do depend on animal control, and they're really, really vigilant, and they work great with us. And they are just like, we got this bird. It's injured in some way, fishing line, and then they bring it over to us.
Mm-hmm.
We also work with Marine Animal Rescue, and they are great help.
And Los Angeles County lifeguards.
Yes,
and,
exactly.
Who else? Oh, and right now we're getting all the seabirds from San Diego County as well.
Yes, that's our new center that they're helping us, and they're bringing them over.
Oh my goodness.
Thanks to avian influenza, seabird is currently not, SeaWorld is not currently accepting any wild birds for rehabilitation. So those animals are coming to us.
So it just really illustrates the network of people that to make something like this successful for an individual animal or many animals for a center. I mean, it really does. It takes a village.
It does, and
Certainly
sometimes that's why a lot of our birds are coming to us a few days later. They stabilize in one center, then they go through transport, then they come to us.
Sure. And that stabilization too, especially if they're coming to another center first, I think is probably fairly critical in survival rates and how long it takes you to get them to the point of hopeful release. So now they've come to your center, right? They've maybe been stabilized, maybe not if they're coming in from animal control. Mm-hmm. And now what happens?
It depends. It's a two-pronged question. HPAI, or high pathogen avian influenza, has kind of changed how we do things, of course. So in our new modern world with this new bird pandemic, we have to have shifted our way. So now, with our new normal, what we will do is that we will get to our intake gate where we take them to quarantine and screening. So even if the injury I'm just going to really focus on fishy line at this case.
Perfect.
Let's just say patient 1, brown pelican, has fishy line injury, constriction wound on its legs. So yes, that is why he came in, but we still want to make sure that we're doing important screening. So we wear a lot of PPE, personal protective equipment. I could go into a little bit more details, but we're covered from head to toe with Tyvek, with surgical gown, N95 mask, goggles. You could check out, I think, our website about a little bit more about that. We take him to our screening tent. We put him down, see for any neurological symptoms or more stuff like that. If they pass our screening, they finally go inside. So part 2 of intake. Once they go inside, we make sure that we are handling it correctly. A lot of staff are doing the screening, so staff having proper holding techniques. We quickly take their temperature, check their hydration. Okay, they're stable enough. If they are, let's say patient 1, it has fishing line, we cut that off, make sure we check for those injuries, do an intake, and then we put them in their enclosure. Okay. Of course, they take more stabilization, but case by case by case.
Where do you check for hydration?
So we do check their eyes. That's a really good indication for hydration. So if their eyelid pops right back into place, that means that they're well hydrated. If it just stays stuck, they're not well hydrated. Also the nictitating membrane, how fast they go back and forth. Okay.
We get a lot of really, really emaciated pelicans that are hypothermic, super skinny. They're just, out of resources.
Sure.
And a lot of times these folks, you can even just pick the bird up and know it's like, oh, he's...
You can kind of feel that
you can feel the body
bones.
feels
light for their size.
Yes.
Yeah.
They'll come in, 60% of their normal weight, so it's fairly significant drops in body
Very
mass.
significant drops. So,
especially if they're coming from out of control, let's say they didn't go to a stabilization center, just straight off the beach, as we say. Mm-hmm. These injuries could kind of debilitate the bird for a while, and then you're like, okay, that's why they were so easy to catch. So, like Becky was saying, they're really, really debilitated sometimes coming in.
Mm-hmm. Okay, so let's say we've got a constriction injury on a leg. For the moment, we'll say that the bird was in good condition, right? Mm-hmm. So not a starvation event. Okay, so we've got a wound. With fishing line constriction injuries, do you often see fractures, or is it mostly just a tissue injury and swelling and possible constriction of blood flow, that kind of thing?
Yeah, so if you don't fish, fish hooks do come in usually with that, and they're into their body. But you have to remember this kind of like a plastic line wrapped tightly around their skin. So it's cutting off circulation, it's cutting into the skin. And, you know, birds don't have a lot of muscle. It's just skin, a little, and then right into bone. So it just cuts right into it. A lot of the injuries we see is on the leg feather line. So we have to make sure to looking at that.
Okay.
Mm-hmm.
One of the odd things about the constriction injuries in pelicans is that, so the most common site is, as she said, above the hock joint, so kind of mid-leg at the feathered skin boundary. But once we take off the constricting line, the skin underneath is dead, and it's like beef jerky. It continues to constrict the leg. So one of our primary goals early on with these constriction injuries is that a lot of times the bird might not be swollen yet, but it will be later.
Exactly.
Interesting.
Yes.
So our main goal on some of those is to soften that tissue over the course of a day or so and get it removed as quickly as possible.
And you're softening that tissue just with...
We use hydrogel. My favorite, I wish we had an infinite supply of, is the silver impregnated hydrogels. Those are awesome.
Yes.
If anyone wants to donate
I
that. And otherwise, regular hydrogel. Silvadene is, last choice. If we run out of hydrogel, we'll use Silvadene, but it doesn't provide enough moisture to really soften it up all that well.
Okay.
Even if you put it on frosting thick.
Right. We're going to get into, hopefully in a minute, a lot more of the medical care surgeries and things like that. But we're going to say, for sake of podcast time, let's go back to, okay, so we've got the bird, physical exam is done. We check beak to tail, beak to feet, everything. One other question is, like, radiographs, blood work, that done on intake, not done on intake? It depends.
Not in quarantine.
No, exactly.
Yes, HPAI has changed so much.
Yeah, we used to do bloods on intake just to get at least a baseline. We don't even do that anymore. We do it once they remove from quarantine, which we have them under for 24 hours.
Got it. Okay. Okay. And then do you regularly do radiographs?
With fishing line injuries, we do a thing we call rule out, where we would just place the pelican on our radiograph machine to make sure that he doesn't have, tightly wound, and then press the button. Go back.
As quick as you can.
Yeah.
It's essentially a box shot, but they're so big that we
Right.
can't just put them in a box and put them on the X-ray machines.
Yeah.
It's bigger than the plate. So,
Right.
So they get kind of bundled up in a towel
Little
and a
burrito.
sheet, turned into a little burrito with their head, tucked in for a quick snapshot.
Yeah, we're looking
Okay.
for metal foreign bodies, and if we don't find anything there, we're like, yay! If not, then part 2 is holding them down and getting a really good position for us so that Dr. Becky could look
So
at
that
them.
happens later.
Yeah.
And that comes later. Okay.
Yeah.
Okay. So let's say we've gotten all that initial work done, and you need to set them up. And let's say all their medical care, immediate medical care, is done. What's the husbandry like? What is the cage setup? What is the food? What is all of those little nitty-gritty dirty details?
This is, again, case by case.
Yep.
So if a bird is debilitated and cannot stand, we try to put them in these things we call drying pens, which helps them not put too much pressure on hard surface, and these pens also allow them to defecate through, so they're not contaminating their feathers.
So the base of that enclosure is cement, and then on top of that you have... No. So that's the picture I'm trying to get. So
It's like an oil spill pen with net
Like
bottom.
a crib.
Okay.
Yes.
Okay. With a net bottom. And is it about the size of a crib?
Yes.
Yeah.
Okay, so it's relatively small, right? So I'm trying to get the picture whether or not it's like... Okay, for our listening audience, neither I, nor Jennifer, nor Dr. Duerr have children. So trying to figure out the size of this crib size is a little beyond us right now.
Yes, our pelican not standing cage is about the size of one of those playpens that I think humans
Oh,
put toddlers in.
Yeah, exactly.
I use it for loons and
Yeah.
ducklings and
Yes.
things like
Yeah,
that.
those.
Yes,
It's about that
those.
size.
Those,
Yeah.
about that size. Okay.
Yeah.
Yeah. If the bird is standing, we will then put him in a wall cage, which is, as it sounds, a cage with a wall. I don't know the exact schematics.
It's like a standard
of it.
veterinary
Yeah.
double wide wall cage.
Okay.
You put it into a dog or something like that, and it has like metal grates at the bottom. We put towels on there just so that it's a more comfortable space for them.
Okay.
And sometimes we usually put birds in there immediately, just once we could get them to start eating, and two, if they need supplemental heat. Because again, they're really skinny. They don't
Okay.
have those muscles or anything to keep
Right.
them warm.
Especially
and
if
often
it's
they're
gonna be-
cold.
They're really cold.
Ah, okay. Okay.
So we have a space heater, kind of the front covered with a sheet, with the corner lifted up, and a space heater blowing warm air on them.
Do you have a particular temperature range, or it's just like we need to get it warmer than the ambient temperature?
90 to 80,
Sure.
at least, just from what our machines go to.
Sure.
Yeah.
Sure. Okay. In that type of setup, or even the playpen type of setup, when you are, you said you need to get the pelicans to eat.
Yes. So, again,
It's a
going
fine
back
art.
to it, it is.
Fine art.
We call it fish school, and it's really, really cute, and it's really fun, because...
She did air quotes there, everyone. I just want you to know that.
It's great in a sense of like, okay, once you get the bird to eat, that's great. That means that the bird, you kind of be a little bit more hands off of it, and they will start self-feeding. But a lot of times these birds do not want to eat. They're cold, they're dehydrated, so you want to get that supportive care in first. So that's when we introduce the fish school, in which we kind of we kind of slap them in their bill with the fish. But, like, it just
Okay,
like, so
the picture in my mind.
yeah,
It's exactly
Like,
that. It's just
soap opera, not hard, of course, but soap opera, slap across the face. But just gentle taps, of course. You're not
Okay.
trying to hurt the bird. You're just like, and then we like play, like not play with, but play with the fish in the water. Get that like sound, and then this is the best part. You look at the bird's eye, you see the gears turning, you see the little smoke coming out, and you're like, okay, he understands what the fish is.
okay. Okay. In
And
this context,
in
right?
this
Because
context,
they
it's
don't
like-
see it in that context in the wild.
I
generally.
bet it's like all stress, and then they're just like, okay, so they understand what the fish is. You play with them, and then finally get that magic moment where they're like beaking it, drop it, beaking it, drop it, and then they beak it, swallow, and you've successfully graduated from fish school.
Oh my gosh, I bet you're partying in your head when that happens.
Yes, totally.
Oh my gosh.
It's so fun.
How does it usually take one session doing that? Does it take a couple sessions doing that? Does it depend on the individual?
It depends, but a lot of times, not to toot our own horn, but we could get it in one session.
Awesome. Well, you're using a lot of the natural history cues, right? Motion and the sound you said, and even almost the ending feeling, you know, right, which is the touching of the fish on the beak, right, or the bill, right? I mean, that's got to be part of it, even if they're opening up their bill and grabbing it. They've got to. There's texture to it, right?
There is, and it's just like a lot of birds are able to get it really, really quick. And I could go more into later or something, but like the birds that are not, we come back. We don't give up. We just make sure that they get nutrition in other ways through gavage tubing, and then come back to it and come back to it.
And come back to it. Excellent.
And we keep them in a small space when they're
Yes.
undergoing this. It's pretty important for us to keep them in a small space. If we put them in a too large enclosure, which is more of our standard pelican enclosure, then they might just like not pay any attention to the fish dish, and they're going to run away from you and try to strike at you rather than eating. So they have to be focused on the
Right.
fish.
Right. So what I just want to mention briefly, I mean, what you are doing with the fish school is operant conditioning, it's training, and I do a lot of work with ambassador animals, and we use a lot of choice and control and things like that. But one of the basic tenets is setting up the environment correctly for what you're trying to do. And so for fish school, you do want a smaller enclosure because you don't want them, in this instance, moving away from you. So you can interact with them this way and get them working, because eventually they will be in a larger space, and you want them eating on your own because that saves you a lot of resources. time.
We also don't want them to become habituated to humans feeding them.
Exactly.
So it's pretty minimized, the amount
Right.
of time that we do this.
Right. Yeah, you want to do it very, very quickly. How much, a healthy pelican, how many pounds of fish can they eat in a day? Or how much should they get in a day?
So these animals, mostly when we get them, they're so underweight. They're putting on mass like a growing baby.
So they get to eat as many fish
They get as much as they want.
Okay.
Absolutely.
Don't stop it. We just keep going.
And then once they've reached their normal body mass, their appetite definitely comes back off.
Oh, sure.
As
Okay.
you might expect.
Okay.
So I don't know, 5 pounds a day.
I
think
know, that's the thing.
it's a lot.
It's a lot. And that's okay. That's an okay quantity. A lot.
A lot.
A lot.
And we want them to eat. We keep feeding them.
Mm-hmm.
We have never seen any sort of refeeding syndrome in pelicans. They can go from starving to massive appetite to not starving anymore in the course of a week or 10 days.
Okay. That's an excellent point on that. You're feeding dead fish, at
Yes.
least at this
Yes.
point. Are you supplementing with anything?
Yep.
Yep.
They get Missouri large bird tabs and
vitamin
a
E.
little bit of extra vitamin E,
And vitamin E. Okay.
which is kind of insurance against fish quality problems.
Yes.
Sure, because you're getting large quantities of fish, I would imagine, and they're in your freezer, and you're trying to use them quickly. But
But they're, certain fish that we use are only caught once a year. So, in vet school, I always learned, they taught us, don't feed any fish that's been in the freezer more than 6 months. Well, now I know each freezer is different.
Yeah.
Right.
We have some issues with our freezers, but, they belong to the state of California. So it's a little
Right.
complicated getting things fixed. So we've had some fish quality issues in the long ago past that we compensate with nutritional supplements.
Awesome. Okay. Right. So, enrichment, cleaning of the enclosure. So let's say we've graduated from fish school. So now we're going into a larger enclosure.
Yeah.
Okay. What does that enclosure look like?
So we have, it again depends on the injury. So we have outside pelican boxes or inside pelican boxes if the bird is still needs some supplemental heat. We keep them inside.
Or they have bandages.
Or they have bandages that cannot be, like I was saying, weather cannot be wet. So we keep them inside. Or once they don't have the bandages and are doing better, we can move them to our waterfowl enclosures where they have some access to water but are quickly able to get out. Those we find with more injuries like leg
trouble,
injury,
trouble walking type of injuries.
Yeah. And then,
So the pools for that, is it?
it's a gradient.
So gradient
so
ramp.
It's just it's a think of it like a large room, like this hotel room. Not that large, of course, but a large room that
It's
has
bigger, I think.
Yeah, actually, maybe.
They're looking around the room trying to figure out.
And it
how
just
big
has
is.
like a 2
Gentle
to 5
slope.
degree incline. Yeah, a gentle slope. And
So we can choose how much water they get.
And that would be my next question. For a pelican that is having trouble walking, how, are you even wanting them to
If there's
swim?
It depends on their problems.
Okay.
In many cases, we do put them in the water. If they have wounds, we do find it beneficial to not only get them off their feet so that they can float and paddle around without having to bear weight on their legs. But it's also very helpful for some wounds to soak in nice, clean water.
yes, which we change every day.
Yes, or even more often.
Or-
depending
yeah.
on- yeah.
Right. So,
So we have hospital pools that we float them in when
Okay.
they have trouble standing.
Oh, okay. So they can be monitored
Yeah.
and everything so that in case there's any challenges, you are right there to help.
Exactly. So
Okay.
we go either, depending on the extent of the injury, they could go outside and float on their own, or no, they need a certain time hour that we go back to check on them and they just float.
Yeah, there are some injuries. So one of my favorite treatments for some of these constriction injuries on their legs is to float during the day, and then they get wrapped with the dressing at night.
Okay.
Yeah.
Okay. And I bet that feels a lot more comfortable for them anyway because
Absolutely.
that's,
It's
of course,
nice
what
water
they
and
want.
they're not
Yeah.
on this painful leg that's owie.
Yeah, and we can do warm water, cold water.
Exactly,
Depending on the
depending
animal.
Everything. No, it's everything is depending on the animal. It's like
it always does,
so
right?
thank you to
It's
Dr.
always-
Becky because it's I'm trying to think of a patient. I'm like, oh my god, there's so many factors. Like which
factors.
one, which route do you go down?
The water that you're using, fresh water or salt water? It's fresh water.
Fresh water.
Okay.
Yeah.
Okay. Just a clarification because it's we were talking about that they're more marine animals, so
Yeah,
they're not saltwater.
from the work that's been done in the past, it doesn't seem that brown pelicans necessarily need salt supplementation, unlike some other more marine species.
Okay, excellent, excellent. Okay, so now let's say we've healed from whatever it is, yay. Now, but they're not quite ready for release yet. So what type of enclosure are they in at this point? They're outdoors.
This is our pride and joy. We have our small pelican aviary, our spa, or our large pelican aviary, LPA.
LPA.
It's not a good word. But again, it depends also for safety of us techs and for the animals. So when we put them into a small pelican aviary, we want to make sure that they have, it's because we're capturing them every day. So we want to make sure that they're not getting injured in there. And Becky, you could tell me this.
Well, it's a smaller aviary. It's essentially half the size of our big pelican aviary. It's so that we can have animals that are on medications in there rather than being in a large flight aviary where it's more difficult to catch.
Yeah.
Yes, yeah. And it has a large pool in there, so they are able to still swim, have access to that. And then our large pelican aviary, that is for our almost there, but that is a lot of times they're not on SID or everyday meds, and that is where we do a lot of flight assessment. Mm-hmm. So that's why it's our pride and joy.
Pretty intensive physical therapy with some of these animals.
Mm-hmm. And that's what I was going to ask. I mean, we know that they dive for their fish, but we also know they have to fly.
Yes.
And so you have to assess that before release. Yeah. And so what does that process look like in general?
So again, depends on the injury. Depends. So sometimes we do exercises every other day. We want to make sure that they are holding their wings at equal shoulder length, of course. Mm-hmm. And also if they're able to, so we have these 2 perches there, if they're even able to get to the perch, that's one thing. Sometimes our patients initially, depending on the extent of the injury, are not able to get to those perches. So that's why we do every other day exercises, or sometimes need, like Becky was saying, more intensive exercises every day, going in there, making sure that they are getting up to that. And if they do get to those perches, are they flying, how long could they fly? Are they just doing one perch to perch and then I give up, I'm tired, I can't do it anymore? Is their flight equal? And which one feather is super flap and the other one's nice and gentle, how they're supposed to fly?
Right.
So we... So the things that we're looking for are symmetry in flight with the wings. A lot of times pelicans that have had a wing injury will lean their head to one side as they're flying. And so what we're looking for an animal that's ready to be released is they can fly back and forth from high perch to high perch to high perch to high perch a whole lot without getting winded. They don't have any sort of compensatory odd posture either at rest or in the air. So that they're flying straight, they're not doing a head lean, they're not having trouble landing.
Yeah.
All these things. We want animals to be really pretty perfect when they get released. And if they're continuing to improve, we'll keep them longer until they plateau and then make some good decisions about release.
Okay. Wow. It's pretty intensive in that, the rehabilitation, fixing them from whatever injury they have is important, but it's that prep for release that's also important because that's going to determine whether they survive.
And we band them all. They all have color bands, so we get lots and lots of feedback on the suitability of individuals for release.
The flight pen, the large aviary where you're practicing flying and things like that, we've got, it's a pool. About how deep is it?
We've recently got them
I've never been in.
I know, we've recently got them done. I saw one of our facilities in
They're
there.
5 feet deep, maybe?
No, that's above. It's maybe 6 feet.
6 feet deep.
Let's just say that.
And they're quite long, 30, 40. There's 2 of them with a bridge in between.
Okay.
In the larger aviary, and I'm pretty sure they're 30 or 40 feet long.
They are,
by maybe 8 feet wide.
Okay.
They're pretty substantial. It's on our webcam. We have a webcam on.
Not right
And
now.
I was going to ask you if there was a camera on it.
Yeah,
and we
with a
will link the
Pelican.
webcam and things like that in our show notes.
Well, right now it's facing our pelagic pool because we have a lot of grebes. So later
Well, that'll
on,
be cool too.
Yeah, so you can check it out. But later in the year, I'll switch back to pelicans.
Okay. Okay. Oh my goodness. Okay.
Yeah.
When you release them, do you try to get them back to where they were found? Do you try to find a group of pelicans where they are, so you kind of have a decent idea of where might some of these fish are? What are the criteria for release?
So we're very lucky. He made it to release. We're very lucky that we're right by the ocean, at least the San Pedro location. And we have this specific beach, White Points Beach, where we know that there is pelicans usually there. There's actually
Flying by every day.
Yeah, every day. Gorgeous. There's like a rock and there's the pelican. And so we take our 10-minute drive right off to the beach, White Points Beach specifically in San Pedro, and we open the gate and then they come out. We have actually a really nice YouTube video about that, of all of our pelican releases.
Excellent. Well, we'll be linking that too so people can really have a good visual about that. Okay, so we're going to back up. And so we're in rehabilitation. Maybe we've just come in, and now we've got an injury that will need medical attention. What kinds of interventions do you do, Dr. Duerr, as far as getting these birds so that they can go to Jennifer?
Right. So she does anesthesia for me.
Okay.
Yeah.
So she's involved the whole.
All of our
point.
rehab techs do anesthesia for me. So whoever's working on that day, I soak up a technician when I'm there to do surgeries.
Excellent.
So the animals that might need an anesthetic procedure would be the ones with severe wounds, those with fractures, big pouch laceration. Maybe they ingested some fishing gear, although that's much less common than the external injuries.
Okay.
And so one of the things that we do, if they've ingested some gear, of course they'll need more specific radiographs. And then rather than cutting the bird open to remove the gear, we do the human endoscope.
Ooh.
So they get sedated, and then whoever has the smallest hands, who's handy, gets to stick their arm down there and grab it and take it out. Because I have huge hands, and I can really only fit my hand down in the big male mouth. So you stick your arm all the way down there.
Okay.
It's so easy. They don't have to have surgery.
Amazing.
And even if the hook is embedded down there, you can just feel it and just gently back it out. And it's so much less traumatic than cutting the bird open to remove it surgically.
Oh, and to then heal.
Yeah.
And then you've got feathers and waterproofing and all of those levels of extra time in rehabilitation.
So we do that under anesthesia.
Okay.
So usually
I hope so.
If it was a choice between doing it awake versus keeping the gear, especially if I was lead in it, I know there are some rehab centers that do potentially do stuff like that awake, and I can't critique that really.
Sure.
You
I mean, you do what you have to do, and it is trade-offs.
Yep.
Right? And I can see that doing it that way, even if it was stressful awake, might be much preferred to going to surgery.
And we are lucky in California that the style of fishing that people do usually does not involve the ingestion of lead.
Ha.
Super lucky.
Yeah, that's very, very interesting.
Yeah.
And good. And lucky for the pelicans, right? Mm-hmm. So with medical intervention, whether it's taking a hook out, whether it is, we have fractures. Do you do a lot of, you said pouch lacerations, but do pelicans get a lot of fractures? Wing fractures?
They do get a fair number of fractures. In many cases, I pin them.
Okay.
We have a guy right now who had an open metacarpophalangeal luxation that I fixed that's pinned. So I've pinned a couple of those, and we've had good post-release survival on the ones that I've done. It's not the huge numbers. It's like 3 birds, and 2 of them been resided years later type of thing. Sure. But we have one of those right now that's still got the pins in. I'll take out when I get back.
Okay.
There's radius fractures, ulnar fractures.
Okay. Do brown pelicans tolerate bandaging well? Or not?
Absolutely.
Oh, yeah.
Oh, some of these fishing gear injured birds have bandaging on 3 different limbs at the same time.
Okay.
Yeah, we give them like little backpacks.
Sometimes. Depending on where their problem is.
Exactly.
Yeah. Okay.
Yeah.
Okay. So they do, because...
they don't rip anything off.
Okay. I work a lot with bats. They don't tolerate bandages at all. At all. So it's just an interesting question, and some raptors don't either.
They can end up with some foot problems because those constriction injuries on their legs can make them fold their digit number 1 under the foot, and sometimes they'll come in with pretty bad damage to that toe.
Okay.
So we typically might have those birds on a shoe.
Sure.
To keep the toe from being damaged any further while they're healing. A lot of times the control of the toe will return. But if it doesn't, I will amputate that toe.
Okay. And that's still a releasable
Oh, absolutely.
Okay.
Many three-toed pelicans.
Okay.
Yes. 7?
Seven-toed pelicans.
Yes, there are many 7-toed.
Yes.
Okay. Pouch lacerations. Is it a fairly simple procedure to,
It's just long. So it tends to be a long procedure because it's convoluted suturing. So it's really relaxing for me. It's like needlepoint.
because you have to stretch that pouch out because it's...
Well, I try to
Yes?
anatomically put it back together correctly. So they have little fine dark stripes in the pouch. So I'm like, follow the stripes to put
Okay.
it back together. And we put back together some pretty amazingly horrible things. Like whole thing, both sides around the back of the neck, like whopping huge things.
How do they get those lacerations? Is it from fishing gear?
So
Is
it can be from fishing gear with if there's a hook on one side that gets ripped out.
Okay.
I think that the tissue has some strength to it. Melanin is a structural pigment, right? So they have these dark stripes in the pouch. That's part of the stretchiness of it. And I think that adds a little strength to it. So it tends to tear in the direction of the stripes.
Oh, okay.
So
Does that make it easier for healing, harder for healing if they're going with instead of against?
left to their own devices, if they're not starving to death from the wound, they will try to heal it, and they end up with these great big, thick, lippy edges of the wound as they try to shrink the thing.
Sure.
But usually I end up cutting all of that off to fix it and create a normal pouch again.
Okay.
So they can be maliciously caused, but mostly I think they're misadventure.
Oh, sure. That thing is just hanging. I mean, it's not fully out there hanging. It's shrunk up a little bit, but still, it's exposed, right?
Yeah.
I want to get to, unless you have a favorite type of surgery you would like to do or favorite.
Oh, I love doing pouch lacerations. They're a lot of fun. Because it's very delicate suturing. The tissue is like 2 millimeters thick with epithelium, or it's got the outside on both sides. Right. So in order to stitch it, I have to split it the long way and stitch it in each side separately. So it's just like your own cheek, except in miniatures. So you wouldn't want to fold the inside of your mouth to the outside to close it. So you close it on each side.
Okay.
Yeah.
Oh, I'm really glad for that
it's
clarification.
Very, so it's but it almost always heals flawlessly the first time. Every now and then there'll be a little tiny area that's a problem, but yeah.
But they're great.
Yeah,
I
they're
love
great.
healing those. Those are fun.
Yeah, those are awesome.
What is the criteria in an animal comes in medically injured or starving or whatever? So there's some medical interventions that are needed. But you are evaluating that animal for release right away, as soon as it comes in, right? I mean, what's the prognosis here? Or euthanasia, or, so you're trying to figure out pathways here, right? And so what are the things that say, yes, this animal has a chance, we're going to keep going, and has a chance for release, versus this is a permanent injury and is not releasable to the wild?
We have a document that our staff kind of goes by that I wrote. That's our standing orders for certain types of injuries. So if you're an animal that needs to plunge dive, obviously if your wing joints are screwed up, like if your wrist or your elbow is messed up, that's a problem. If something is close and the staff isn't sure, then we have a WhatsApp group for vet queries.
Technology, I love it.
They send me pictures of wounds and radiographs.
Bug her so much.
And both centers all the time. And it's so we do a lot of groupthink on prognosis for some of these weird problems that we see in pelicans. So we see some really complicated injuries that we decide or not decide to treat, especially if hooks were in bad places, joints, tendons, etc. A hole in your chest with the air coming out. Problems like that we'll discuss.
Okay.
That aren't an obvious euthanasia. But yeah, so like any wildlife center, we have criteria for what we will euthanize immediately versus let's try it, see how it goes.
Okay, and see how it goes. Right. Excellent.
Yeah, and pending what, Rebecca, we might want to cut this, but I do feel that we are always willing to try with brown pelicans. Because they're amazing healers, and a lot of the staff here, especially, that's why we really like discussing these, because we're like, well, yes, this is the issue, but this is what we're like, per the guidelines, this is what we're willing to try.
Yeah. Step one, the first criterion, they're pelicans, so
Yes.
they can heal most things.
Yeah.
Well, and that's, it's so interesting, right? It sounds like they are so resilient.
They are so resilient. We have so many patagium injuries and they're fine. We have great post-release survival in these animals.
Wow.
Like, oh my God. Yeah. I've put back together their extensor carpi radialis muscle, and that's fine. They fly great. It takes months sometimes to get them over some of these injuries.
Sure.
We see a lot of tendonitis problems, issues like that from the fishing line. But we just, as long as the animal is continuing to progress towards release, if we have to keep them for 8 months, it's fine.
Okay. Oh, yeah, it definitely
we treat them like gold, really.
No, we do, and it's like the gold standard. But
the gold standard.
Yes, but
But they need to be good functional birds when they get released.
Exactly.
Right.
But
Yeah,
the
so you
things that
have
they're
a
able
high
to
bar.
overcome.
We got a high
release.
bar.
Yeah, we do.
which
But the
is-
things that you're able to overcome, it's just what we're willing to try.
Okay. Oh, love it. I did want to briefly talk about in May of 2022, you had an pretty, from my perspective, extraordinary event where you, in over 2 weeks, how many pelicans, emaciated pelicans, did you receive?
I'm messing up the numbers because I'm writing a report for U.S. Fish and Wildlife Service on it that involves all the rehab centers. So
Okay.
I have those numbers in my head, not ours.
Not
Yeah, not
okay.
LA.
About half of them came to
Okay,
us.
so Jennifer gets to answer this question.
I don't know, like in 2 weeks we received like 363 or something. No,
No, it wasn't that many. It just
wasn't.
felt like that many.
it did.
Right. But it was over
Space.
300.
Yeah, the bulk of them
Yeah.
came in over this really narrow time period.
Yeah.
Right. Okay, so that to me qualifies as an emergency and disaster response type
Yes.
of
Yes.
emergency. So did you get wind of this before they started showing up at your door, or okay, so you're able to prepare a little bit?
What happened first?
So this is such a funny conversation. Remember when we were like, CWC was like, everyone was like specifically texted you?
Oh,
And
yeah.
you're like, we're seeing these pelicans. We're getting like, so the other centers got hit first.
Okay.
Then we were kind of hearing these calls. It was like, we got like 10 pelicans today. Oh, we got like Santa Barbara. CWC is like, oh, we got another like 10 pelicans here. And we were like, nah. Well, yeah, we're like, maybe, but like, nah, it can't be. Can it?
Disbelief is always first.
Yes,
Yes.
of course. The 5 stages
It'll be
of
nothing.
grief.
5 stages of grief.
Denial.
Yeah.
Yeah.
But quickly we were like, okay, no, this is actually happening.
Yeah.
And then we were receiving them. I wasn't there for the first day, but I remember Liz getting like 20, or one of our other techs at our Southern California centers, getting like 20 in one day just from Santa Barbara, just from one center.
From one center. And all of these birds came from mostly one area or just all up and down the coast? Because
I know the answer to these things.
Ooh,
Yes.
yes.
I have the graph I made in my head. So over the course of May 10th to May 25th, the rehab centers in Los Angeles, Ventura, and Santa Barbara counties received 560 live brown pelicans. This is not counting any of the ones that were dead on beaches.
Okay.
So and I was thinking that maybe this was a wave of animals that moved up the coast, but no, everybody got hit simultaneously. And it peaked on May 18th with more than 100 new pelicans coming into care, spread across all 3 of us.
Wow.
And smaller numbers in the outside counties like Orange County, San Diego, up to Monterey. So it was very focal to that area of Southern California. And then it didn't really stop. Like, it dwindled after May 18th was the peak, but then even through the end of June, we were still getting abnormally large numbers until, so my report is actually going May 1st to the end of July.
Okay.
To try to get both ends of the event.
Sure.
But it was pretty intense.
Yeah.
Pretty intense.
Very
And
intense.
most of those centers all transfer to us, right? So it was all 3 of the counties where we get most of the pelicans. Santa Barbara
Like, we
ultimately
got another 10.
did keep some of theirs, but we were actually limiting them to how many they could send us every day.
Yeah. We just couldn't.
Because we were getting them from our own county and from
Right.
Yeah. So
Malibu coast. Yeah.
Yeah, I'm sorry, but yeah, not just the transport. So we did have those daily transports from both centers. I'm just gonna say our primary centers, but like that doesn't mean that people weren't coming at the door ringing our
Yeah.
doorbell.
Right.
So we had public, we had animal control. I got the numbers of like just personally on my phone of just being like, could you guys just at least tell us when you're coming up so we could like mentally prepare and just physically prepare because like great pride and joy right now I had with Santa Monica Animal Control. They were bringing 8 every morning. They were at our door at 8 a.m. like, here you go.
Here's what we collected overnight.
Just over the night. And then, you know, of course, we're just getting just like constant, like, here you are, here you are, here you are.
And then Santa Barbara and California Wildlife Center
everything.
show up at the same
At
time.
the same exact time. Oh my God, right? Sorry, it's just funny. You're like gonna take a bite of your sandwich. You have your good bite, and then like, ding, 40.
And then there's 40.
Yeah, it was pretty spectacularly crazy.
Yeah. So you're running out of cage space. Your staff and volunteers are getting very tired.
Yes.
So you go into emergency mode, right? So what kinds of things that people should know, like maybe the high points of like emergency? We have to make sure that we've got a point person that does this. We have to make sure that we've got enough caging. So this person is going to make sure that we get other portable caging or things like that. I mean, are there things like that you go into right away to be able to handle that?
Yeah.
Yeah.
So first thing is that we had an event going on.
Yes.
This is a thing.
This is a thing.
The thing is occurring. And then all the logistical problems that can arise from those circumstances coming. Like you got to look a couple days in advance. Like, how much fish are we going to need? How are we going to deal with thawing fish? Where are we going to get it from? Do our current stores of fish have enough to last how long? All this sort of stuff. And housing, like what's the condition of the animals? At the time it was like, is avian influenza hitting us? Is that what this is? But none of the animals had any neurologic signs. They just seemed like normal starving pelicans largely, with a chunk of them having injuries. Mm-hmm. So we decided, early on a few animals were tested and nothing was showing positive for that or for harmful algal bloom.
Right. Okay. Okay.
So,
Wow.
yeah. So caging is, of course, an immediate issue,
Is an immediate issue.
but we're good at improvising.
We are, and it's because we stand on the backs of giants. Thank you, guys. It's just like we have our center manager, Kylie Clatterbuck and Julie Skoglund, who just like, and Michelle Belize, these ladies, these have been in these emergency situations where they're like, okay, this is what we do, and we just follow through with the plan. So just a little couple highlights is that if you don't have enough cages, we have these giant, like, tents that we could put them in.
Like camping tents.
Yeah, camping tents. So
Set them
we
up
got
inside.
like tent city, and then we like put them inside, and they could go in there.
Yeah, they're
And-
sorted by what their needs are. So these are the ones that are thermoregulating. These are the ones that are not eating. These are the ones that need intensive care, like fish
okay.
schooling,
Yeah.
etc.
So triage is very important to set up immediately.
Do they have temporary bands on so you know who's?
Oh, yeah.
Okay. I mean, like how
Every
you
single
tell
one.
one from another.
Yeah.
Right. Okay. Okay. So and that's the organizational system is important. Of course, you have a lot of experience with oil spill, and you have to do that emergency response. So I'm sure that a lot of information was drawn from
Yes,
that
it
to help
definitely
with
was.
events like this.
Yep.
So what that says to me is that pre-planning, that pre-thought, even though you weren't prepared for this particular emergency, you had a lot of the pieces and parts already because.
Oh yeah.
Yeah.
So you could just
It's
deploy.
really what we do, and frankly,
Yes.
it's what we excel at.
Right. Oh my gosh.
The adrenaline kicks in, and we go.
And you go.
Yeah.
And you go.
And even we didn't really have to do any different standard of care than we normally do.
Right.
What we were able to do with the animals that had injuries was deal with their immediate needs, and get them started on meds and whatever, and then be aware of their problems, catalog their problems into their records, and then gradually start, after we had a handle on the situation,
Right.
processing them for their further stuff. So any of the animals that came in with fishing line injuries, those got bumped till later, while we were dealing with all the starving hypothermic birds.
Right. Right.
So I do say that I was part of the Pelican event, and I was, and this is why I worked really closely with Dr. Becky in this part. But it was I was actually not part of the Pelican rehab team.
Okay.
Oh, yeah.
I wasn't. That's
You're
why.
right.
Yeah, I was
Yeah, yeah.
actually clinic myself because like that's how we split it up. So my poor other fellow coworkers dealt with that. And I'm like, oh my god, that's so sad. And then,
You're like, I have to take care of everything
yeah,
else.
I took care. I took one volunteer with me, and I took everything else. But again, like she was saying, like there are some patients that they require more intensive care, so they were shifted over to me in clinic. So that's how
Okay.
we was like separated.
Oh, excellent.
for,
Excellent
like,
detail.
Just everything else, and then that's where I communicated a lot. Like so, the main one that
Yeah.
comes to my mind is that guy.
Yeah, I
Yeah.
forgot you did that. And so at the beginning of the event, we had maybe, I don't know, 25 or 30 animals that were not involved in the event, just our ordinary patient load.
Right.
So those get separated.
Oh my gosh.
Like there's this one white pelican who was already in the aviary.
I have a picture.
Poor guy. Poor guy. All of a sudden
Maybe
he
we can
ended
get
up
a
with-
picture, that picture, so we can put on the show notes or
Oh,
put on
yeah.
the resources.
Just
so you
one
can see
confused.
before.
Like he had come in for
white
I
pelican,
don't
like,
know,
what's going
radius
on?
fracture or something like that.
Radius,
or
ulnar,
ulnar, I forget.
and pelvic, and
Oh, and clavicle.
Oh,
He had a
my
lot of
goodness,
fractures.
he had a lot of fractures.
So he was out in the large pelican aviary. Didn't need a lot of care. He just needed time to finish recovery.
And he's like, what's going on?
And the
he had
aviary
that
ended up
sole space to himself.
right. He was like alone out there, and then all of a sudden there's like 80 brown pelicans there. But meanwhile, we couldn't assess whether he was ready to release
Yeah.
until we got rid of the brown pelicans. So he ended up staying a little extra long.
Sure.
He got really fed.
And you got fed a lot.
Yes.
Okay, so now we get to the point where a lot of these pelicans are ready for release. They get banded and then released, and I bet everybody was celebrating every time you got one more out the door. So I wanted to transition just a little bit to the long-term citizen science project that's been happening on brown pelicans. So briefly, if you want to give the background to that.
Starting in late 2009, which is coincidentally right when I started being their vet, International Bird Rescue started putting on blue with white lettering auxiliary bands on the opposite leg from their federal band. So they
Okay.
have a easy to read letter number combo on a leg. And we have a website portal where people can report those and submit photographs, etc. And so prior to this event, we had banded about 1,500 birds.
Okay.
They're former patients since 2009. Now we're up to 1,700 and something after the event.
I bet that
So-
bumped your numbers.
So we've had, tons of, like thousands and thousands of re-sightings of about 50% of the birds that have ever had a blue band put on.
Okay.
So, what else can I tell you? So, during this event, it was very quickly another logistical problem is that we don't have enough blue bands for these birds.
Right.
So, we need to get them made immediately. So, and we don't know what the environmental conditions are since most of these birds were starving. It's like, is there anything to eat out there? They were doing all sorts of weird, going to inland lakes in the LA County and going to all sorts of strange places. We got one
Yeah.
bird from Bakersfield.
Two from Arizona.
Yeah, anyway, it was kind of chaotic. Like, where's the food?
Right.
But it in conjunction with the California Department of Fish and Wildlife, we were trying to figure out what to do. So we were delaying starting to release the birds until we could get them all banded, and we were hoping that the circumstances in the ocean would change a little bit. So we started releasing in mid-June.
Okay.
And then we were releasing them in dribs and drabs, like half a dozen at a time.
Okay.
And that went on. The ones with the worst injuries, of course, stayed the longest. But I think the bulk of them were released by mid-August.
Okay. And another just shout out for collaboration and working with the agencies and things like that to
Yes.
really help with this rehab process.
Yes.
Because you're right, you needed to know where the food was because
Yep.
you don't want them to go out just to starve
And then come
again.
back.
Right.
Yeah.
Yeah, and it was completely possible that when we released them off of Los Angeles that they were going to have to fly to Monterey Bay before they were able to eat a lot.
Right.
So apparently the fishing was quite good in Monterey at the time. So, yeah. So, and some of them were, many of them were recited as far north as San Francisco within a week or two of release.
Excellent. And of course, this type of work with the banding and the citizen science not only gives action items and things like that for the general public, because a lot of people are very interested in animals, but it gets them more interested, and it gets information about how well these animals do after release and that kind of thing. So it just broadens the community interested in wildlife and care for these wild neighbors we have. So it's very, very interesting. Any last things you would like to share, and maybe hopefully this won't be our last conversation, whether it's about brown pelicans or other species of birds you get, but any last tips or tricks or knowledge, or if somebody's like, they live on the coast and they're like, I want to do brown pelicans.
They need a lot of anesthetic procedures. It is, they really get these horrible wounds, but they're so resilient. But many times, a particular individual might get anesthetized, 6 times or something through the care.
Okay.
Depending on what they need. But some of the wounds are horrendous, but the birds are resilient. So we deal with all sorts of nasty wing wounds, nasty leg wounds. They say birds don't make liquid pus, but they sure do. Staff refers to sometimes some of these constriction injuries will end up being rivers of pus coming out of their leg. Fish hooks are nasty.
They are.
Absolutely nasty, dirty things that get poked into tendons and bone.
Yeah, all kinds of nasty.
Yeah, and I am highly against those fake fish with a treble hook on each end are the worst things in the world for wildlife. They often create lethal injuries.
Yeah.
A simple hook and a line might give us a constriction injury we can fix, but those things usually wreck at least one joint.
Yeah.
Wow.
Yeah, they're horrible. We like to ban them.
Okay. Well, and things like that are, it's not an easy fix, but it's like you can point to, look, you could take care of a lot of those types of injuries if people just didn't use that.
Yeah. And a lot of the injuries that we see with these fishing gear is the person is probably casting into where the birds were hunting, because they'll have hooks in the back of their neck or somewhere else on their body. It's not like the bird is eating the bait.
Yeah. Right.
We also see birds come in with like half a dozen of those little sabiki rig hooks,
the little tiny
which
ones.
people use these series of tiny hooks to catch bait fish. So the birds will be tangled in those with like 6 to 10 hooks on them with line, like mummified in the line.
It's almost like barbed wire in the
Exactly.
water.
Yes.
Exactly.
Yeah.
That is exactly.
Yeah, it is. It's terrible.
And I don't like barbed wire at all.
Yeah, so many hazards for being a wild animal.
A lot of hazards. I want to thank you for coming and taking the time at the conference, at the 2023 conference, to talk to everybody about brown pelicans and an international bird rescue. So appreciate your time. And I am just as excited right now as I was when we started this conversation, and even more interested. So we will definitely have some things in the show notes for our listeners, to links to IBR and maybe a picture of that white pelican. Anyway, thank you guys so much. Really appreciate it. Appreciate your time.
Thank you.
My pleasure. Yes, thank you so much for having us.
Really appreciate this. Thank you.
That was my recent discussion with Dr. Rebecca Duerr and Jennifer Martinez of International Bird Rescue. We caught up with each other at the 2023 NWRA Symposium in Wilmington, Delaware. Thanks for joining us for another episode of Wildlife Rehabilitation from Rescue to Release Season 2. Wildlife Rehabilitation from Rescue to Release is a production of Partners for Wildlife, working hand in hand with wildlife rehabilitators and veterinarians to improve the welfare of orphaned, ill, and injured wildlife. Our executive producer is me, Gail Buhl. I'm the Partnership Coordinator for Partners for Wildlife at the University of Minnesota College of Veterinary Medicine's Raptor Center. To learn more about the Raptor Center and Partners for Wildlife, visit raptor.umn.edu. Our producer is Kurt Clockey. On-site production assistance was provided by Kylie Komp of Discover Media Works. Special thanks to our guests, Dr. Rebecca Duerr and Jennifer Martinez, International Bird Rescue, NWRA, Partners for Wildlife, and the Raptor Center at the University of Minnesota College of Veterinary Medicine. And that's our show. Hope you'll join us again next time.